Hi, Dad. Will Medicare cover my long-term care expenses?
You cannot, please, my friends, do not rely on Medicare for your long-term care needs. Now, when we think about Medicare, right, we think about extended indefinite stays in, adult daycare or assisted living facilities or nursing facilities. Medicare does provide limited coverage in skilled nursing facilities, provided you meet certain pretty narrow guidelines. And then even if you meet those guidelines, the coverage is pretty limited. So some of those guidelines, you have to have been hospitalized for a Medicare covered service or ailment or expense for more than 3 days. So you have to have been hospitalized for 3 or more days. Then you need a physician's recommendation, your attending physician's recommendation that says that your enrollment in a skilled nursing facility is necessary. And then from the time you are discharged after that stay of 3 or more days to when you are enrolled in that skilled nursing facility, no more than 30 days can pass. So you have a 30-day window. And then, and this is the stipulation, this is the guideline that trips most people up. Your condition has to be improving. Now, if you think about traditional long-term care, when you go into one of those facilities, your condition is typically not slated to improve. It's either stabilize and then deteriorate, unfortunately. So the coverage under Medicare Part A is temporary. It's supposed to kind of get you back on your feet, and that's why it's limited. But provided you meet all those guidelines, what does Medicare pay? Well, Medicare will pay 100% of the first 20 days that you're in that facility. After that first 20 days, then you're responsible for co-pays for the next 80 days. So that's 100 days. There's no more Medicare coverage after that 100 days. Why? Because it's meant to be temporary, to get you back on your feet. You cannot rely on Medicare for your long-term care needs. You can't. Now, Medicaid, on the other hand, and what's Medicaid? Well, Medicaid is the health insurance for, impoverished folks. So folks that have low income and low net worth. The rules around long-term care for Medicaid are much more liberal. Much more. But in order to be eligible for Medicaid, right, you got to have low assets and low income. But Medicaid pays for a lot of long-term care in the United States. In fact, according to the Kaiser Family Foundation, Medicare funds about 54% of long-term care costs. So if you can't do Medicaid, don't want to draw down all your assets for Medicaid, because that presents other risks, you're not going to be in these guidelines pursuant to Medicare to provide temporary coverage in a skilled nursing facility. What do? Well, you can self-fund, say, okay, well, I'm going to build up my asset base. I know these long-term care costs are going to likely to come, and I'm going to have this bucket of money, and I'm going to pay for it myself. I'm going to self-fund. Or you could purchase long-term care insurance if you're healthy enough, if you're young enough to purchase it now for the future, right? If you're already older, that long-term care insurance, if you can get it, is going to be very, very expensive. But you can think ahead and try to get that sooner. It's still going to be pretty expensive. And those policies can be pretty complicated. And those premiums for that long-term care insurance could increase every year, right? They can increase annually, so you have a risk there. And what's the risk? The risk is that those premiums increase at a rate by which, by the time you get to retire, you can't even afford those premiums anymore. And now you have this policy that you're paying for that's going to lapse because you can't afford it because the premiums, or even the business the insurance company goes out of business, right? So you don't want that risk. Long-term care it's a tough nut to crack, but we can plan for it if we have an idea of what coverage is out there. My goal for you, because healthcare is one of the major costs of retirement, well, we got to plan for it because you only have one chance at a successful retirement.
I got it. That makes sense, Dad.